This was an amazing opportunity and really was a culmination of many of the things and efforts that we had already been working on with helping practices go to the next level for starting to track measures, starting to engage patients in their care, starting to really redesign into team-based care, be much more proactive about this, start looking at patients in a holistic position, and being able to really change the experience for both patients and the healthcare team.
When I first heard about the Patient-Centered Medical Home Pilot Project via an email, I thought, wow, it just clicked. This is who we want to be.
The Patient-Centered Medical Home model came around, and it gave me a blueprint for the first time in 25 years of how a family physician should be running their practice and the kind of care they should be delivering.
What we've learned is that 97% of the time, people are left to their own devices to manage their health care. And the real focus of this work is empowering people to take better care of themselves during all of that time that they're not face-to-face with a provider.
Being a patient-centered medical home, one of our greatest goals is making the plan with the patient, making sure they're on board, that they're going to follow that plan. If they don't want to follow it, then they're not going to do it.
I think this last year I've seen so dramatically that for me the biggest value of being part of patient-centered medical home is the empowerment that I have being engaged in my own healthcare.
Patients learn that they too have a higher, an opportunity to provide for a higher level of care for themselves as they learn how to manage their own health in a better way, as they learn that they have a responsibility to do that, and they're really the only ones that can do that.
So we have done 2 smoking groups now, cessation groups, and our first group meeting consisted of 14 people. Out of that 14, we had a 50% quit rate.
To hear that as many people as we had in the group go through the exact same thing and do the exact same, the habits and the feelings and the depression almost and all of that went along with it, it was a huge help. And it was, you were accountable, right? I wasn't going to come back in here and say I started smoking again.
Right.
No way.
I would say that of the most dramatic changes that I've had in my health have been because of what I've learned in group visits.
I think the one thing that's helped me the most is having the option to come to a meeting where I can talk to other diabetics freely and get their input.
One of the aspects of becoming a patient-centered medical home is improving access to your practice, and we want patients to feel like that they can either come to us or at a minimum call us anytime.
And then the online communication that you have here, you can set appointments, you can ask questions, and you get a response back. Electronically, they'll send me my labs, so blood work, any type of tests I've had done, they send me those results there. And I can go through them in the comfort of my own home, right, and try to understand them and then call and talk to them about that without having to come in for an appointment. And that is huge with everybody's schedule.
When we started thinking about it, we had the response that probably every practice does, like, we are already working our tails off, how do we work longer, harder? And that's not really what it's about. And so we kind of gave that to our staff and said, how are we going to do this? We would like to expand our hours. And they came back with an idea. And so what we ended up doing is we went to a 4-10s, a 4 10-hour day schedule for everyone in the every staff member of the practice and the provider too. And so people were excited because they were going to get a day to take care of their banking and all the other things they needed to do, and therefore willing to do that 10-hour shift, which was required to make that happen.
So we have now designed a program that's called Passport to Health, and it is a series of 5 visits, each visit about an hour long, and in each visit there's a separate topic that's addressed, like diet, exercise, stress management.
So we've done some education for our patients, trying to educate them about what probably doesn't need to be seen in the emergency room and what we can take care of here. There's a lot of patients that don't know that we can do stitches and we can do an x-ray.
I had a patient who was on his way to work, clocked his head on a thing in the parking lot where he works in the parking garage, split his head open, he's bleeding, and he called us. And we were so happy that he called us because a lot of people would just go straight to the ER if they have a laceration or bleeding.
I'd much rather come here where they know me than going into the emergency room or urgent care where I'm a number.
We had a 5-year-old who were getting ready to put to bed, and he had stuck an eraser in his ear. So Mom was getting ready to put him to bed, panicked, and said, I'm just calling you, I'm gonna take him to the ER. And I said, well, you don't have to take him to the ER, you can meet me at the office. And so, she was floored. She didn't have any clue that we could do that here. And, we were in and out of here within 30 minutes. So, I think that is my job as a provider. In order to keep him out of the ER, it's got to be more than just the lip service. We actually have to go above and take care of that.
You get so many people thanking you for being available, and you really are providing them an extremely valuable service, keeping them out of unfamiliar urgent care.
On the practice transformation side, within our practice and how that has affected our staff, it's been great in so many ways. It's been a challenge in other ways. We ask a lot of our staff, and it's a big change to go from I'm the doctor and I rule the world and tell you what to do, and all you have to do is do it. Now we're bringing you in as part of the healthcare team, and we're asking you, what do you think? And we're asking you, well, great, that's a great idea. Let's do it. And in fact, why don't you lead it?
The staff has a different relationship with the patient, and it really helps lend to this whole collaboration thing. The doctor is just one person that's in the office.
Now, since we became a patient-centered medical home, I actually get to do a lot more things. Like we have standing orders where I can give the shots before the doctor ever comes in. We do pre-visits before the doctor ever comes in. We do standing orders for labs. So a lot of those things, I have more responsibilities, which I love. I feel more part of the team.
The man comes in first and gets the vitals, asks all the questions, and she puts it all into the computer. So it's not just in a piece of paper that's going to be forgotten.
Teaching people how to do quality medicine and quality improvement really has brought my team together. Everyone has contributed in some great way to the whole patient-centered medical home practice.
To provide a coordinator who can interact with you, for you, with either telling you how to make your appointments or how long you might have to wait. Just knowing that is huge. If someone says, you know what, this is going to take a week to get back, then you're not so afraid all the time or waiting for the phone to ring.
One of the things that I think that the family practice is great at is that she doesn't try to be every type of doctor there is. She refers you to the specialists that you need.
Part of my job as the care coordinator is to run data and quality improvement type things, and what we really look at are our chronic illness patients, and so running data to make sure that we have their health needs under control. It's been interesting as a pilot practice of the medical home to see patients we're given expensive medications to, they can't afford them, and we didn't know that until we started doing the quality improvement that came with that.
Another thing we've done from the patient side of things is really work on the transition of care from emergency rooms and hospitalizations to the outpatient setting, and really trying to bridge that gap.
Electronic records for me saved my life at a point after an accident when I was not in a position to be a good communicator with my doctor. She was able to see exactly what all the doctors in the hospitals had done. So I did not have to regurgitate all that information to her. I couldn't have done it.
It is so wonderful. If every practice could be like this, and if we could then spread this around the world, it would be so good for the world.